Hello again. Well, today in our Health and Science Focus, we're talking about the world of aesthetics, whether you're thinking of a little nip and a tuck, a little filler or Botox there, or maybe a boob job, a reduction or enhancement, whatever it is. We're looking at the pros and cons, and we're just getting the experts to give us some advice, those who work with us every day, on just when it's needed, when it's not needed, and what you should prepare yourself for. Well, let's look at the psychology now behind wanting to actually look good. Sometimes there seems to be an obsession, maybe even an addiction to cosmetic procedures. Clinical psychologist Khosi Joyane joining us this morning to talk about just our mindsets when it comes to this. Khosi, a very good morning to you, and thanks so much for your time this morning. I'm not sure if you heard the conversation with Dr. Ridwan Mia a little earlier, but just some sensible advice there. But I'd like your take on why is it that we as human beings feel the need, let's just get very basic, feel the need for self-improvement, especially as we get older?
Well, I think we are sold very much. I don't think it takes too much effort to just go survey the media and see how much advertising is in the business of making us feel not good enough, less than. There's always something that needs to be improved. There's nothing really in the social space that is about celebrating who we are. Occasionally, now and again, we will be told that you're good enough as you are, but for the majority of the time, advertising is actually the business of driving that sense of not good enoughness. And of course, there's always something that is available out there to make you, telling you the idea that you can feel better about yourself by enhancement here and there. And we are told, how we have become commodified as human beings in that the possibility of, changing and replacing parts of ourselves with, away.
And I agree, Doc. A large part of this is due to what society places, or the emphasis it places on aesthetics and how we look, and society's idea, or whether it's magazine editors, or whether it's, whoever's out there for putting out images of beauty and perfection. That's a lot. That plays a big part in this. But what about many people who just look at themselves every day? It doesn't have to do with the images they're seeing out there. And if you find somebody who's practically anorexic looking in the mirror going, gosh, I'm too fat, I could lose another 5 kilos. Or, somebody who's really doesn't have that many wrinkles but feels, I really feel like I need to do this for, whether it's for a partner, for a boyfriend, whether it's for people at work. That for me is the danger or the tipping point.
Sure, absolutely. So I think we're talking about a spectrum here, in that we're saying, okay, all of us, practically most of us, have a sense of this could look a little bit better and so on, but there is a line that I think we draw in terms of just natural, not maybe natural, but just like everyday enhancement, and the point where it becomes a disorder. So you mentioned, for example, anorexia and body dysmorphic disorders. So that's that's an extreme level of dissatisfaction. And as much as it plays out in terms of the visible side of it being, if we look at anorexia, for example, the emaciation, it's more the psychology, what's happening in the psyche of the person. And the issues run much deeper than that, because if we follow that line of thinking, it would suggest that all of us are bombarded by the same media images, but not all of us gravitate towards that point. So it begins to tell us that there's some psychological fallout, some psychological injury that is going on, and it expresses itself through those things. So it indicates something much deeper, and therefore a need for professional intervention rather than just, the social conversation about it.
But look, on the other hand, there's nothing wrong with wanting to just be a better version of yourself at times. So I don't want to be negative about the procedures as well, or what people might want to do. I mean, if you're somebody in your 60s and you feel, this line needs to go, or maybe just a little bit here to just make me feel better about myself, that's okay as well, isn't it?
Yeah, absolutely. No, we're not in the business of beating people down for, looking for a little bit of an enhancement here and there to feel better about ourselves. Because I'm sure it would be denialist for us to say, okay, I'm perfectly happy with how I look every day and so on. And as much as we want to celebrate the journey of life and say, that things will change and so on, we do get to that point where we think, I'm not ready for this. And so what could I do to kind of, uplift this and that and the other? So we allow that, and I think it would be socially social injustice for us to be beating down on ourselves for that. But I think, you know, as we're saying, there's a line and a healthy boundary. And always the question then becomes, and I think the conversation picking up also on from what the doctor was saying, the important conversation from a professional point of view is what is going on psychologically, you know, that makes the person feel that's inadequate and therefore the need for going and to what extent are they willing. And there's a line that needs to be drawn because these things are addictive. Once you lift the one part and there's always now another part that also could be improved. And it can go on, and that's where it becomes a problem.
So let's talk about that line. What is that line? When do we realize that we might be going too far? Or when should it click that we might be going too far? Even if it's not for the person, for those around them to say, listen, now you actually look like a completely different person. We don't even know who you are anymore.
Yes, exactly. So I think what matters is what point of good enoughness are you looking for? You know, and unfortunately, as the doctor was saying, that we are sold the idea that we can look this glow and this old shining perfection and so on because of the times that we are living in. And if that's the goal that you're chasing, this impossible perfection, so to speak, then there's something that, you know, it definitely has crossed the line of just normal and enhancement that all of us kind of can relate to. But I think when people begin to raise eyebrows about the fact that it is going a little too far, it is perhaps a wake-up call for you to just perhaps go within, and the question becomes, what is it about me that I am so uncomfortable with, that I feel that this outside will help me achieve that? Because many a time, it is actually compensating for something that's going on internally that you're looking for outside, and it never will hit that spot because you're trying to sort the inside by changing the outside, and it will never work.
Well, I'd like to take that a little bit further. You talk about the questions, that the conversation we should have with ourselves, and we're talking about somebody who's completely sort of mentally healthy, let's put it that way, but wants to have this procedure done. They're just feeling like they want to give themselves a birthday present or a Christmas present or a post-COVID present or something like that. So what's the conversation? Is there a list of questions? You mentioned some of them just now. Let's take that conversation further with ourselves.
Well, I guess the conversation is simply, okay, so why do I think I need to do this? Why do I think, is it a need or is it a want? And of course, it's important to separate that. And I think in this case, when we say it is a need, it begins to suggest that there's a part of you that feels kind of at a loss without it. There's an insufficiency in the self without this thing. And whereas the one says, look, I'm okay, I'm good enough with this, but it's a nice to have as opposed to a need to have. And I think that's the sphere where we are saying kind of the normal average person of well-being, psychological and emotional well-being. But also the question is, who am I doing this for?
Yeah, I think that's a very important question.
Yes, who am I doing this for? Because, you know, as you were saying earlier on, it might be that my boyfriend likes women with bigger boobs, you know. And I think, you know, there's a line there. Are you feeling that yourself, or is it because you are responding to someone else's imposed fantasy or impressions or desires that you don't own yourself? And I think there's a problem. And it suggests that it's the conversation that needs to happen in the relationship. First, the relationship you have with yourself and the relationship you have with your partner, about their need to see you in a different way that makes you uncomfortable. It's one thing if you're of one mind around the fact that, yeah, I also actually would like to have a bigger size, but if it's not something that you own as a desire for yourself and you're doing it for someone else, what happens when they...
And very quickly for us, Khosi, how do you treat this kind of addiction? Is it, I mean, with drugs or alcohol, there's something sort of tangible. You can wean or try or go dry or whatever the story is. How do you deal with this kind of addiction? I would imagine it is just as difficult, if not more.
Yeah, it's a series of conversations, and depending on the situation, we may need to kind of unwind and go back in time into the person's earlier life, the formative years, because those are so important in that's where our sense of self is written into us. And later years will either enhance that or erode that. So we want to understand what is the internal scaffolding and how are you scripted by your early life experiences into a sense of I am good enough as I am, or who am I to myself and for myself, as opposed to the external treadmill to try and live someone else's.
Okay. Khosi Joyane, thank you so much. If you're thinking about maybe having that bit of a nip and a tuck, there's some questions you need to ask yourself. And the big question is, who am I doing this for? Why am I doing it? Still to come here on our Health and Science Focus, we'll take a look at the difference between invasive and non-invasive surgery, when it is actually required. We've had a bit of an explainer with Dr. Ridwan Mia as well, but we'll talk to somebody who deals particularly with aesthetics, and that's non-invasive surgery, and when you can do that instead of going under the knife.